is mental health? Mental health is a dynamic landscape where emotions shape our well-being. It's a spectrum, from the brief beats of anxiety to the soulful echoes of depression. It's a living masterpiece, influencing thoughts, feelings, and actions, a tapestry of our shared human experience. The first one of objectives is raise awareness, boost employee and leadership knowledge and comprehension of mental health concerns in the context of the digital era. Second is to implement support systems, create and execute accessible mental health support systems for employees that make use of digital tools and resources. Number 3, training and education. Provide training programs to educate employees and managers with the information and skills they need to recognize, address, and assist mental health issues in the workplace. And lastly, flexible work arrangements. Examine and establish flexible work arrangements that take individual mental health needs into consideration, particularly in a digital work environment. In the digital era, our organization is a dynamic hub of innovation and collaboration. Beyond technology, we prioritize employee well-being, harmonizing professional excellence with personal tranquility. We're not just in the game, we're leading the charge for progress and fulfillment.
Statistic of mental health in Malaysia. Certainly, the landscape of mental health in Malaysia has been an area of increasing concern. With a population of over 30 million, mental health issues have become more prevalent, affecting various age groups and communities across the country. As of the most recent data available in Malaysia, 1 out of 5 adolescents experience depression, 2 out of 5 have anxiety, 11% has suicidal thoughts, and 10% has attempted suicide. This statistic has raised alarms within the healthcare sector and among policymakers, drawing attention to the need of increased awareness, access to mental health service, and the stigmatization of mental health conditions. Anxiety and depression constitute the most common mental health challenge faced by individuals in Malaysia. Factors contributing to this rise in mental health issues include societal pressure, economic stress, lifestyle change, and the stigma associated with seeking mental health support.
Symptom of mental health. The sign and symptom of poor mental health may arise from physical, social, and environmental threshold. First, physiological. It may predispose or exacerbate physical illness such as cardiovascular disease and hypertension, causing headache and muscle ache. Second, behavior. Work performance may be declined, prone to accident, absenteeism from work, aggression and irritability, work decision and problem-solving capabilities. And third, psychological. Dissatisfaction, moodiness, depression, emotional fatigue. The most common symptoms of poor mental health in general are irritability, difficult to sleep, loss of appetite, loss of weight, anxious, frequent palpitation, and feeling demotivated.
Addressing mental health issues in the digital era requires a multifaceted approach involving individuals, communities, organizations, and policymakers. Here is a methodology for organizations to play a role in promoting mental health and well-being. Firstly is mental health awareness and education by develop and implement mental health awareness programs. These can include workshops, seminars, and informational campaigns to reduce stigma and increase understanding of mental health issues. Next is needs assessment and understanding. We can conduct a comprehensive assessment of the mental health needs within the organization. This could involve surveys, interviews, and data analysis to identify common stresses and challenges. Thirdly is telehealth and teletherapy. We can offer telehealth services that allow employees to access mental health professionals remotely. This is especially valuable in the digital era when remote work is common. And lastly, promote work-life balance. We can encourage employees to maintain a healthy work-life balance, particularly when remote work can blur the boundaries. Promote flexible work schedules and discourage overwork. The implications and impacts of mental health issues on organizations and employees in the digital era are significant. Here's an overview of how mental health issues affect both and the role organizations play in addressing them. Firstly, we talk about implications for employees. Firstly is stress and burnout. The digital era often blurs the lines between work and personal life. Constant connectivity and remote work can lead to increased stress and burnout, affecting employees' mental health. Next is productivity and performance. Mental health issues can impact an employee's productivity and performance. Anxiety, depression, or other conditions may lead to reduced focus and energy, making it difficult for employees to perform at their best. Thirdly is absenteeism. Mental health issues can result in absenteeism as employees may need time off to address their mental health challenges or attend therapy sessions. This can disrupt work schedules and impact team dynamics. And lastly, employee morale. When mental health is not prioritized, it can lead to low employee morale and engagement. Employees may feel that the organization doesn't care about their well-being, which can lead to a negative workplace culture. Now, let's talk about implications for organizations. Firstly is decreased productivity. Mental health issues among employees can lead to decreased productivity and subsequently financial losses for the organization. Secondly is higher healthcare costs. Organizations may incur higher healthcare costs due to mental health related medical expenses, including treatment and therapy for employees. Thirdly is high turnover. A lack of support for mental health can contribute to high employee turnover. Employees may live in search of a more supportive work environment. And lastly, legal and ethical issues. Neglecting mental health can lead to legal and ethical challenges for organizations. Failure to accommodate employees with mental health conditions can result in legal actions and discrimination claims.
In conclusion, while progress has been made in acknowledging and addressing mental health concerns in Malaysia, there is still much work to be done. The statistics reveal a significant portion of the population affected by mental health issues, indicating the necessity for continued effort in advocacy, resources allocation, and policy implementation to ensure that mental health support is accessible to all Malaysians regardless of their location or background.
Recommendation. The organization role in employee mental health. First, culture change advocates for a top-down approach to workplace mental health, involving leaders, manager and employee. Prioritizing mental health, creating a stigma-free environment, investing in diversity, equity and inclusion, DEI and empowering employees. Next, more sustainable way of working. Employer should encourage sustainable work practice such as flexibility and autonomy to maintain mental health during remote work, emphasizing the importance of leader modeling, healthy behavior and providing necessary resources. Finally, deeper connection. A culture of connection is crucial, involving regular check-in, healthy working relation and meaningful team interaction.